I had a Vespa, a beautiful 250cc Vespa, and I was driving that to meet my sister one night for dinner, and a car coming the other way turned left basically into me. I tried to put on the brakes and sort of swerve, but I ended up coming off of my scooter and hitting my shoulder.
The brachial plexus is a complex of nerves that powers the entire arm. And when a patient injures their brachial plexus, that can cause either a partial or complete paralysis of the arm, which of course is a very devastating injury. When Jen came to see us, she had paralysis of her shoulder and her elbow. And this of course affected her life in many ways and made things that she enjoyed doing before the injury very difficult. We evaluated Jen in our multidisciplinary peripheral nerve clinic, and we devised a surgical plan for her. She actually had 4 nerve transfers to bring the life back to her paralyzed muscles in her shoulder and her elbow, and she's done extremely well. One of the things we love about treating patients with this type of injury is that we really get to know them quite well over the course of 1 to 2 years when we're taking care of them. And we really enjoyed getting to know Jen. Jen was a very fun patient. She took a big role in her rehabilitation and her recovery, and she really participated to the fullest. And we think that's why she's had such an excellent outcome.
I've been able to get back into playing some tennis, and I can even do a two-handed backhand, sort of. And then I also started playing on a over 30 soccer team.
So Jen has done very well. One of the things we first noticed about Jen was her participation and her ideas and motivation and what she wanted and what her goals were. She had already been doing things and trying things, and so that was great because she was already really involved and really motivated.
One of the pioneers in this field says when you don't have anything, something is a lot. And that is what we try to do is encourage patients, but at the same time understand your arm is never going to be the same, but we should be able to improve it quite a bit and give you some function. So that's one thing we try to do with each patient is set realistic expectations. And that's a balance that as a team can be hard for us to find, that balance of encouraging them but not deflating them, but also having a realistic expectation.
It's very important that they understand that yes, there are things that can be done, there are surgeries that we can do to promote recovery. However, there is a critical time component to when these surgeries can be performed. And patients who have brachial plexus injuries need to seek care with a brachial plexus specialist as soon as possible after the injury so that appropriate plans can be made. If they do not seek care in a timely fashion, then their arm may be permanently paralyzed.
I guess the thing that I love the best about the Mayo Clinic is they always tell me I'm so young and fit when I come here.